Hello, and welcome to today's episode 2 of the Derrick E podcast. In today's podcast, I wish to address the matter of using gene treatments to cure diseases. I wish to make you aware of a lot of the scientific developments that are currently going on all around the world with the use of genes, some of which you may have already heard about, and some may be new to you. However, let me say upfront, gene treatments are very expensive, and so they should be funded by publicly funded healthcare programs in order to benefit persons, since normally they'd only be afforded by the very wealthy persons in many countries. All members of society have genes. Some of them carry genes that may be defective and which may be passed on to their children. And so their children and some of them may need gene treatment at some time. And so we should always seek to make certain that there is some access to gene treatments that may be used to cure diseases. Let me now address some concepts. I want you to get these concepts clear. There is somatic cell and gene cell. Germline treatments, intervening in germline, is prohibited. It is somatic cell treatments that is allowed by the laws of ethics, by the rules of ethics. And so you may ask, what is germline? Well, germline really refers to the sperms and eggs that carry on the characteristics that pass on to our offspring, but our physical characteristics. And so there should not be any intervention in this passing on of germline germline information to our children. What is ethically permissible is the intervention in somatic cells or physical cells that exist in our bodies that have the disease, not in those cells that are going to pass on information to our offspring. And so we need to get that clear. Another concept I wish to point out to you today is the difference between features and diseases. What are features? Well, it would not be ethically permissible, for example, for parents to ask doctors and scientists to use human growth hormone to make their short child taller. Why? Because height is a natural feature of humans. Some of us are tall, some of us are short. And so shortness of height is not a disease. Remember, I said we should only use gene treatments to intervene in diseases or to prevent diseases. So, for diseases such as HIV infection and cancer, it would be ethically permissible for us to use genetic treatments in the fight against such diseases. Hence, we move on to the concept of regulation. Regulation, that is the laws that exist in our country that control particular actions, is what we would need to have for genetic treatments. Since, just like any other experimental treatments, when they are first being brought to market, there are regulations to ensure that these new drugs, be COVID-19 vaccines or others, that they are not harmful, so they are regulated. Likewise, we would need such regulations for gene treatments when they are first being introduced into a society. Those societies should have laws and regulations that will supervise, monitor the use of these treatments. I also wish us to consider the fact that when we study genes, we are not just studying the genes of human beings, but we're also studying the genetic makeup of viruses, of bacteria, and other causes of diseases, because we wish to know all of what exists in order to benefit human beings. And so laboratories doing these studies exist all around the world and are performing these research endeavors on a daily basis. in order to improve our understanding of the process. We should therefore be very critical of information that may seem to malign the work of such laboratories. It is speculated, we have seen the proof, for instance, that the COVID-19 virus came by escape from one of these laboratories that was being experimented on, it was being studied. Conspiracy theories always arise in many areas on many things. We need to see the proof because generally such laboratories doing research are there to help us. So when we hear things that do not seem so right, it's better to go to the sources such as the World Health Organization or PAHO, the Pan American Health Organization, where countries, the 215 countries all around the world, have put together their public health efforts to form these organizations to help us. They're not there to harm us. There's no reason why 215 countries will be financially contributing to the WHO, the World Health Organization, to cause harm among their populations. So you can't trust whatever the WHO says because they are there seeking to come up with new ways to minimize harm to all our various populations within all our various countries. So let's now move on to successful gene treatments. If we consider how gene treatments may be beneficial to humans, they do this by altering the DNA inside the human cells, the harmful DNA. They use a method, enzyme, that is a type of enzyme that causes splicing. It slices out the bad portions of the DNA, of the bad DNA, and replaces it with a good portion of DNA. Consequently, those cells that have been spliced and corrected, they go forward in the future and will function normally. Now, to do those procedures inside the lab, you need a laboratory rules. And that is where regulations of these laboratories is critical. In Europe, in the United States, and other industrialized countries, rules and regulations and recommendations exist about the procedures to be done inside the labs to minimize the risk to laboratory workers or the risk of the inadvertent release of any virus into the environment. And so the rules are obeyed 100% of the times. However, we know people can make mistakes, but the mistake should be minimal and should be minimized by strict rules and the implementation and monitoring of those rules that exist in those laboratories. In regards to potential harm, we should know that gene treatment of the somatic cells, the physical cells within our bodies, are very effective, but sometimes can cause side effects. And so if there is any harm, we would have to splice and alter and remedy those harm that have been affected by any treatment that alters the cells in some way. We should also know that the use of stem cells is important. Many of us may have heard of stem cells, some of us may not have. But we need to know that many organ systems in our cells have stem cells. These are the master cells that can reproduce themselves and may undergo changes, a scientific process called differentiation, into a full set of cells that form the human organ. And so it's important for the work that the organ does. And so let's use a specific example. Blood stem cells exist in the bone marrow. And from these stem cells come the end products. They produce end products such as red blood cells, white blood cells, platelets, and all the various factors of the immune system. And so we should be aware of stem cells, that they are critical for certain organs to function because they go on to produce the various types of cells that those organs need. And so gene therapy becomes important in that consideration. Some genetic diseases are caused by the absence of a single gene or by the gene being present but failing to act. And so gene treatment seeks to repair those cells that are affected. If we think, for instance, of the disease of hemophilia, many of us know that name, that disease. That is when persons having this disease have blood that do not clot. In other words, they do not have the clotting factors to cause the wound to clot and seal off, and so they can actually bleed to death. And so the process may involve where the liver of that hemophilia patient do not produce the necessary clotting factors that would prevent blood clotting, and the gene that determines its production is missing in these persons. And this is an inherited characteristics. Hemophilia runs in families because the offspring do not get the gene that tells them to produce the product that prevents the blood clot. And so in gene that promotes blood clotting and sealing of the wound. And so in gene treatments, the person's cells may be engineered so that the missing gene is inserted artificially using certain splicing enzymes. And those genetically corrected cells may then be transfused back into the patient through an IV line. And so that is one of the ways in which gene treatments can be used to treat hemophilia patients. That cellular repair technique may also be used in other diseases such as cancers. Cancer, as you know, is the command and control mechanism going bad, because when those cells are always multiplying, reproducing themselves, your skin cells are being shed and being replaced by healthier cells every few days because of the wear and tear on our skin. And there is a controlled process for the shedding of old cells of the skin and being replaced by new cells. It is when that control mechanism goes bad, gets out of control, that we have cancer developing. We have continuous reproduction of cells without any control. And then cancer occurs, whichever part of the body is involved. Those cells are just growing out of control without any control being in place. And that is where gene therapy may also be used. Controlling abnormal cells whose growth and multiplication process has gone bad, thus leading to cancer, whichever part of the body is occurring. And so we can put a new gene into the cancer cells so that these cells can then produce an antigen on the surface of the cells. Since this new antigen was never seen before, the person's immune system would then attack those cells, those markers, and therefore killing these cancer cells. And so the person's immune system would therefore kill cancer cells and so get rid of the cancer. This is one of the ways the new developments taking place in technological and scientific developments, where gene treatments can be used in this positive way. Another way in which gene therapy may be used is helping to trick a person's immune functions. For example, if a person needs an organ transplant, whether it be a heart, a liver, or a kidney, normally the patient's immune system would identify that the organ coming into the body is foreign and so attack it if it is placed in that person's body. That is why we have to suppress the person's immune response when they're getting a new heart, a new liver, a new kidney, because their body regards it as foreign and it is triggered to fight and protect the body against anything foreign. In these cases, gene treatments could be used on the person's immune system to trick or alter its response and to make the body therefore tolerant to the organ that is being transplanted. So the person may benefit from a new kidney, a new heart, or a new liver. There are also other uses of treatment of gene treatments. We may use genetic engineering for the purpose of delivering drugs to the body. In other words, we could stimulate certain cells to produce a specific protein for actual use inside the body. So instead of manufacturing a drug in the factory, shipping it around the world, and then injecting it into a patient, cells may instead be used, engineering it to alter to produce the specific protein that is needed by the body, and then that is then injected at the site of the body where it is needed, where that specific biological activity is needed. Treatment of arthritis is a specific example of this. Another possible use of gene treatment is to treat brain tumor. As many of us know, the brain, once it is formed, usually remains stable, and brain cells do not ordinarily divide. So if by the various scanning, MRIs and so on that we use for the brain, and we detect that cells are actually dividing in the brain, then we can fairly assume that tumor cells are occurring, that there is some multiplication cells in the brain, those are tumor. And so what has been called suicide genes, scientists can then insert the viral gene treatment into the target cells in the brain that are dividing. And so the targeted tumor cells could be destroyed. Consequently, there is a vast array of a possibility for gene treatments that I've just mentioned, just some of them to you, that are very helpful, currently coming on the market and can be used in the future once they can be afforded. The techniques may be used for diseases of the blood, cancer, cardiovascular, heart disease, diseases of the lungs, liver diseases, diseases of the skin, and infectious diseases. Gene treatments may also be used for certain types of arthritis, certain type of rheumatoid arthritis, involving the injection of genetic treatments into the synovial fluid of the joints. And so, going forward, there is great potential for gene therapy and the great benefit that it can be used for persons once it is strongly regulated, just as all experimental treatments, when they're first been introduced into the market, is regulated. These treatments carry great potential and should be helpful to all of us going forward and looking forward to such help in the future. This today is my summary talk on using gene treatments to cure diseases. And I ask you to look forward to my next episode when I will address other matters that are highly beneficial and reflect new technological developments in science and medicine, and which I hope you will gain not only the knowledge, but spread the word, tell others about it, and be able to watch my podcast deliveries each week, all of the various subjects that we'll be dealing with going forward. Have a great day and look forward to you joining me again soon.